Good day, Kaalaga! My name is Leia, your future nurse. Today, I will demonstrate to you the assessment of the skin, hair, and nails. But before that, I will briefly discuss these three areas for more broad understanding. Skin is composed of three layers: the epidermis, dermis, and the subcutaneous layer. The outer portion of the skin is called epidermis, which is most exposed to friction. For example, on the client's fingertips, palms, and soles of the feet. While the dermis is a connective tissue that firmly attached below the epidermis. It consists of two fibers. One is collagen, which provides the skin its toughness and it allows to resist to tearing. Two is the elastic fibers, which gives the skin its elasticity. In the subcutaneous layer, are also called hypodermis, it can be found below the dermis, that cushions the body structures against from trauma, insulates the body from heat loss, and stores fat for energy. Regarding to the hair, it is a thin, flexible, and elongated fibers composed of dead tough protein called keratin. It grows out from the follicle found in the dermis. It contracts and stands upright when the person is feeling cold or under stress because of the erector pili muscle on each hair follicle. While in the nails, it is a thin plates of keratin cells that protects the sensitive fingertips of the fingers and toes. As the nail cells grows out from matrix, it forms transparent layer that is called the body of the nail. It appears pink because of the blood supplies underlying in the dermis. Now, let's move forward in doing the assessment. First, identify the client to give the right care and management to them. Then, introduce yourself to the patient. Explain clearly the procedure because it allows the patient to understand and encourages compliance throughout the assessment. Provide privacy by drawing the curtains and closing the door to allay fear and anxiety. But before you perform the assessment, do not forget to wash your hands properly for infection control or to reduce the spread of microorganisms. You can also use gloves to protect the patient and at the same time yourself as the healthcare provider. Aside from that, ask the patient to void first to have a continuous procedure and to be not distracted while performing the assessment. Then obtain the patient's history. Good morning, sir. May I know your name?
My name is Lex Machuli Combalser.
My name is Leia, your nurse for today. How are you?
I'm good, thank you.
I would like to ask your permission because I'm going to do an assessment in your skin, hair, and nails to check if there's any abnormalities or lesions in the areas. I also need to ask a few questions with you, sir. Is it okay with you?
Yes, it's fine.
Okay, thank you, sir. Do you have any history of skin disease?
No,
Are you feeling itchy?
no,
Did you go to the beach recently?
yes,
You use sunblock or sunscreen to your skin?
no, I don't.
Okay, sir. Remember, it is important to your skin to use sunblock or sunscreen when you are out in the sun because it prevents skin cancer.
Oh, okay, thank you.
We will do an inspection of the skin. Take note, inspection is a visual examination of the patient within the nurse's observation. Let's position the patient in a comfortable one. If the patient is able to sit down on their own, let them be. But of course, give assistance if not. The patient can lay down on a bed or sit depending on their preferences. Do not force the patient in a position that is convenient for you. Remember, the patient must be comfortable and he or she is the main priority of the assessment. Encourage the patient to position facing on you, and then instruct the client on what are you going to do. Observe for cleanliness and use the sense of smell to determine the body odor. And observe the client's skin tone. Take note the abnormalities that you can find. Okay, sir, do you want to lay back on the bed if you are comfortable, or you can just sit?
I would like to lay back on the bed.
Okay, sir, we need to remove your shirt for more clear inspection. Is it okay with you? Okay, sir, I will now assess your body. It seems that you are negative on foul odor, and I do not see anything pallor or paleness. There is no cyanosis, a dark skin, that it appears blue-pink on your face, chest, upper extremities, and lower extremities, and erythema, and also erythema, which is red, or jaundice, a yellow skin tones upon inspection. Can I see the color of your palm? It is normal. And overall, the skin tone is normal. And I don't see any abnormalities. Remember, if the patient smells like urea or ammonia, it means he or she has a kidney disorder, and having a pallor or cyanosis or paleness or dark skin, it indicates that the patient has a abnormal low plasma oxygen. Now, inspect the even skin pigmentation over the body and superficial arteries and veins. Okay, sir, I will check your skin variation. I do not see any freckles, white patches. You have moles in your face. The lower extremities. Sir, can you please stand up so I can see if the back of your knee has a superficial arteries and veins? Okay. Okay, stand up. Okay, sir, I don't see any signs of superficial veins. Okay. Any moles, white patches. You can now sit, sir. Okay, sir, you have moles in your face, and there is no presence of superficial arteries and veins. Let's move forward on the palpation of the skin. Take note that palpation is placing your hands or your middle 3 finger pads on the patient's body to determine the things like swelling, masses, or area of pain of the patient. Instruct the client on what are you going to do. Determine the skin temperature and assess the amount of moisture in the skin surfaces. Okay, sir, I'm going to palpate your skin. Is it okay with you?
Okay, it's fine.
Okay, sir, I'm using my dorsal, the back of the palm, checking the upper extremities, your chest, your neck, your face, down to your lower extremities. It's warm to touch. Also your lower extremities. It indicates that it is normal. Okay, I'm checking your face, your body, if it's moist. Well, the room is well ventilated, so your skin is dry and warm to touch. It is normal upon palpation. Palpate the skin for texture, thickness, and elasticity. Okay, sir, I will check your skin texture. You have a smooth, firm, and even skin in your upper extremities, down to your lower extremities. Now I am checking the thickness of your skin. It is thin and firm. It indicates normal. Also in your lower extremities. Sir, I will check your skin turgor and its mobility. So by pinching the skin up in the part of your clavicle, the mobility of your skin is easily pinched. And when I let this go, the turgor goes back less than 2 seconds. It indicates that the skin elasticity is normal upon palpation. Remember, if the turgor goes back for more than 2 to 3 seconds, it is abnormal. It is caused by scleroderma. And to check the edema, you must press the lower extremities, and after pressing, if the skin is indented, then the patient is positive for having edema, wherein edema is probably caused by accumulation of fluid in the intracellular spaces. That is usually the patient who has heart and kidney disorder. Take note that the scoring of edema is 1, 2, 3, 4, pitting edema, wherein 1 mm to 2 mm is equal to 1 pitting edema, and so on. Next, inspect and palpate the skin for lesions and sensitivity. Okay, sir, I will check and palpate your body to check for any lesions or sensitivity. Okay. Proceed, sir. Okay. Okay, I don't see any lesions. Okay, sir, I'll palpate your skin. Do you feel pain?
No.
Here, sir.
No.
Here, sir.
No.
Here.
No.
Here. On this part. In your lower extremities. Okay, sir, you are negative for any lesions and for sensitivity upon palpation and inspection. Now we will do the inspection of the scalp and the hair. Instruct the client on what are you going to perform. Observe cleanliness and the client's hair color. Assess the texture of the hair while observing the amount and distribution of the hair throughout the scalp. Then inspect the scalp for any lesions. Okay, sir, I will now proceed to the inspection of your scalp and hair. Is that okay with you?
Yes, it's okay.
Okay. Okay. Negative for foul odor. I don't see any dandruff or lice. The hair color is black. It is smooth and straight. The hair does not brittle. Your hair is evenly distributed. Overall, I don't see any abnormalities on your scalp, your hair. It is also negative for any lesions. Remember, having an excess dandruff present a skin disorder like psoriasis. And graying of the hair means nutritional deficiency. The last assessment is the nail. First, instruct the client on what are you going to perform. Assess for hygiene. Inspect the nails for uneven pink skin undertone. Assess the capillary refill. And inspect and palpate the nails for shape and contour. Lastly is palpate the nails to determine the nail's thickness, regularity, and attachment to the nail bed. Then inspect and palpate the cuticles. Okay, sir, the last assessment is your nails and toes. Is it okay with you?
It's fine.
Okay, sir, you have clean nails. Good hygiene is nice for the body. You have short nails and pink undertone. which is normal. Let me see your toes. But in your toes, there's some dirt around with other toes. Now I'm going to check your capillary refill by pressing your fingertips of the thumb. 1001, 1002, 1003, 1004, 1005. And I will let go. It goes back quickly in less than 2 seconds. You have a round shaped nail and the angle is 160 degree. The nail is smooth and firm. Your toes. It's not spongy, and the cuticle is smooth and flat. Thank you, sir, for your cooperation.
Thank you, Nurse Leia.
Take note that in a capillary refill, if it is more than 2 to 3 seconds, it is abnormal. And if the nail base is less than 160 degrees and more than 160 degrees, it is also abnormal. Evaluate the other needs of the client and record the collected data to have a legal documentation wherein it is the basis of the patient's condition. Start the used gloves and place it in the correct receptacle. And then, wash your hands properly for infection control. I hope I clearly present to you the assessment of the skin, hair, and nails. Once again, kaalaga, your future nurse, Love, Leia. Bye!